common everyday anxiety that would be diagnosable would be something that we would call generalized anxiety disorder. So that would be something where an individual is excessively worried. This is someone who finds that there's something that they're worried about, and those thoughts are pervasive. They find that they can't block out these thoughts, and that no matter how hard they try to distract themselves, they find that a large portion of their day is still spent worrying about something that's going to happen. The other thing you might notice is that a lot of times the person is focusing on what ifs, or what I like to call crossing bridges that they're not at. So they're thinking towards the future and already starting to plan out things that may never happen. Or the individual is doing things what we call catastrophic thinking. They're thinking the worst. They might have something coming up. They've been asked, for example, to speak to their supervisor, and immediately the assumption is, oh my gosh, I'm going to lose my job. Why are we assuming and jumping to the worst case scenario? So, and again, what it comes down to is feeling that they don't have control over what's going to happen. So you'll notice these patterns in the person's thinking. And then what you'll also start to notice are things like an interference or an impairment in sleep, an impairment in focus, impairment in appetite. You'll also notice physiological reactions, as I mentioned, like palpitations, sweaty palms, difficulty concentrating. The person will actually be jittery or have trouble. They'll need to fidget with things, difficulty sitting still, difficulty focusing and maintaining attention on things. And that's really the most common form, both in children and adults. The most common type of anxiety that you will see is just a worry that's gotten out of control and is now causing the person a marked amount of distress. The person will actually say that it's uncomfortable, that it's something that's bothering them, as opposed to, yeah, I'm a little worried about what's coming up, but when I want to distract myself, I want to go, if I'm with friends, I'm okay. The person will say they're not okay.